Now, joining us live is our Health Minister, David Clark. Good evening, Minister. Has anyone else tested positive?
Good evening, Lisa. No, I have not had any further reports, but you'll be aware that today we announced the second case of COVID-19 confirmed in New Zealand.
When are you expecting the test results on that woman's partner?
I would expect that they'll be back later this evening. As I say, I have not yet heard back from health officials on that, but I would expect that to be later today.
And will you make the results public as soon as you get them?
Yes, the Ministry of Health has worked hard to try and make sure results are out as quickly as possible in these situations. Obviously, in the first instance, they have to let any people directly affected know. That is a priority. And today, where there was a family situation, make sure that schools where this family had children enrolled had the appropriate information, accurate information, which indicated there was next to no risk for the schools. But you can imagine the panic if that hadn't been lined up first to make sure there was really good information for those schools in place.
Because the thing is that Ashley Bloomfield has said the New Zealand public will be made aware as soon as the results are known. But the results came in at 6 p.m. last night, and in fact, the World Health Organisation beat you to the draw, didn't they? That's how the general public found out what was going on. Is that right?
It was. I think the World Health Organisation was one of those outfits that was informed. There's a very clear protocol around making sure that first the family, those affected, those who've been tested, are informed first. That medical staff are updated, the WHO, and I think it was within minutes that then the public were told. But we are working to make sure that people are informed as soon as possible, because it's important to have a clear and accurate picture of where things are at. But I think people will understand that making sure those directly affected, like those who might be connected to the family through schools or other activities, making sure they have accurate and up-to-date information first has got to be the priority. We're focused on making sure that public health is the first priority.
Because it's a trust issue, isn't it, that the public can trust you to present the information to them. And again today, in announcing the airline flights that this woman was on, some of that information was incorrect too. That was put out into the public domain by the Ministry of Health, wasn't it?
Well, it's really important that we get all the details right, because otherwise people can naturally develop fears. So there's a lot of checking going on. You'll appreciate these are rapidly evolving situations, and I have to say I've been impressed so far by how quickly the public health people move. Of course, because they're already doing the contact tracing as quickly as they can, there's a risk that some of the information becomes public before announcements are made. They are moving at pace, but we're endeavouring to keep the public informed as best we can along the way, whilst putting public health and safety as our number one priority.
So why isn't this woman in hospital or somewhere in controlled isolation?
Well,
like at
there's very good reason
for example.
for that. Yeah, there's very good reason for that. The evidence suggests that 80% of people recover from the COVID virus without further special medical intervention. Self-isolation is a proven and effective way of containing things. Epidemiologists will tell you that. It's based on past experience with these similar kinds of illness, and now we see overseas. Part of the advantage of us moving very quickly on border restrictions has been that we have had COVID arrive here later than many other countries.
I understand that, Minister, and I'm sorry to interrupt.
That's given us the chance
but
to make sure we've got the right strategy in place.
I'm just wanting clarity around this particular point, because that seems to fly in the face of what you've been telling us previously. So people from the Diamond Princess and people who were evacuated from Wuhan, they were put in isolation at Whangaparoa. So was that just for perception?
I think in the very early stages of the outbreak, we were taking a cautious approach based on the fact that the actual understanding of the virus was at a very early stage, and we are learning day by day about the nature of the virus.
So you're no longer taking a cautious approach?
Oh no, we're certainly taking a cautious approach based on the best scientific evidence that we've got and the medical advice. We are. Today the expert advisory group has met again. One of the pieces of information that's come through in the last few days is that actually the rates of infection amongst people under the age of 19 are incredibly low in China through a big study there. 2.4% only of people who've been infected by the virus under the age of 19. These are emerging facts. The fact that people don't seem to be conveying the virus unless they are symptomatic is different to the flu. So there's a lot of things that are emerging, and as I say, it's
so was the
that we've had
isolation
these
of the Diamond Princess passengers and the Wuhan people unnecessary in reality?
Look, I think in the context of the information that we had at that time, and particularly in the terms of the Diamond Princess, where that had to be one of the most intensely concentrated outbreaks in the world, we were right to take a cautious approach.
But it wasn't actually necessary. That's what you're saying now, based on the information you have.
I'm not saying that. I'm saying based on the information we had at the time, it was very clearly the right thing to do, and we make no apology for putting the public safety of New Zealanders first.
Okay, so this woman now, in the case announced today, she arrived back in New Zealand on the 25th of February. Northern Italy was already in lockdown at the time she got on her plane to come home, but New Zealand had no isolation restrictions around that region until Monday. Does that indicate to you that you moved way too slowly on those border controls?
When she got onto the plane on the 24th of February in Italy, there was 124 cases, I think, in the whole of Italy at that stage, which is a very big country with millions and millions and millions of people.
But most of them in northern Italy?
Yes, and only 124 cases at that stage when she boarded the plane. She was not unwell. And New Zealand, in fact, was one of the first countries to move on asking people to go into self-isolation that came from Italy. There are a number of Pacific countries and Israel and the UK now, I think, only. We are amongst the first movers in the world, but again, that cautious approach, I think, is serving us well.
Even if you were a first mover on this, evidence is that you did move too late, or we wouldn't have a case who had been out in the community.
I think we've got to look at this in the context of a global outbreak where we've got over 90,000 cases. New Zealand now has 2 confirmed cases. We have been effective at keeping this out. Of course, as the situation develops, our Australian neighbours have over 30 cases now. We look across in the United States where they are beginning to believe they've got a community outbreak. This situation is changing day by day, and that's why we're asking the expert advisory group to meet every day and give us an update. We want to act on the best medical advice and the best scientific advice available.
So how many contacts are you trying to trace for this woman, and how many have you managed to make contact with as of now?
I haven't had the exact numbers, but what I can tell you is that certainly obviously the schools are not at risk. That's been made clear from our public health experts.
But isn't that vital information? Are you not being briefed on this, Minister?
To answer your question, Lisa, the close friends and family that had been in close contact with the family have been contacted and put in self-isolation. I'm aware of that. Where they are up to in terms of tracking the people on the airline, I have not yet had that briefing.
So what advice is now being given around domestic travel, and what briefings have you had on that?
In terms of domestic travel, at this stage, there are no implications. But as I say, we're day by day receiving advice from doctors and asking questions.
So currently, how many people do you have who are presenting symptoms that could be COVID-19 that you are waiting on tests for?
Well, every day at the moment there's about anywhere between 20 and 40 people getting tested. As you'll know, we've had close to 200 tests now with only 2 positive tests. So
but numbers
the bar to
exhibiting
testing is
close
low.
Symptoms?
We've only had a handful or fewer of those who've actually been suspected cases. So, you know,
and
again,
how many
we're going to be asking the
outstanding
question.
now with suspected cases?
Well, I know of one that is a suspected case. We're testing the partner of this woman that has tested positive.
Appreciate you joining us. That is the Health Minister, David Clark.